Once it has been diagnosed as a case of malignancy related to thyroid and we are suspecting follicular thyroid carcinoma, and surgery is the main treatment for that to start with. Now, it's a teamwork actually. The person who's going to, doctor who's going to operate is ENT surgeon, or it may be general surgeon also. But we need help of nuclear medicine, radiation oncologists and endocrinologists. That's why I'm saying it's a teamwork. You'll understand when I talk more about it in part 4 and part 5. So once it is decided that you have to undergo surgery, a battery of tests will be done, and with that you have to get a clearance from the anesthetist, and he may ask for a clearance from physician and cardiologist. Maybe the patient has got some other medical problems. So once you get a physician clearance and cardiology clearance and the clearance from anesthetist, the date will be fixed. So you should get admitted 1 day prior, and you have to sign the consent in which it is written the diagnosis, the surgery, what surgery is going to be done, and the complications of surgery. Now, that particular night, the previous day night of surgery, you have to be nil per orally from 12 midnight. Next day morning is the surgery. Before starting surgery, let me tell you about the complications, which you have already signed in the consent paper. One is bleeding, which can be primary in the theatre, or it can be within 2 days. Second one will be change of voice, which can be temporary or permanent, depending upon the extent of damage. Breathing difficulty, which can be temporary or permanent. And how do you deal all this? I'll tell you after the surgery. The next complication is hypocalcemia, which is very important. It has to be picked up early, and we need early treatment too. So this I'll deal separately. Now, hypothyroidism, which can be well taken care of. And the least one is all these which I mentioned, these are very important ones. The least important one is a prominent scar. So before surgery, we would like to know whether both vocal cords are working normally. For that, you will to confirm that, you will have to undergo a flexible endoscopy, which is painless, hardly take 2 minutes. So the surgery usually lasts to about 2 hours, and you are going to undergo total thyroidectomy or near total thyroidectomy. So after surgery, you will be shifted to post-op ICU, surgical ICU, where this will be a position, propped up position, and oxygen may be going on, and along with that IV fluids, and you will be continuously monitored. The heart rate, pulse rate, oxygen saturation, respiration rate, temperature, along with the staff nurse will ask you whether you have any discomfort in the neck, whether you have any breathing difficulty or not. Antibiotics and painkillers will be on, and there will be a drain so that the blood doesn't get accumulated in the neck. This drain is a vacuum drain. What you see in the monitor is a vacuum drain. I'll show you a video also. And this vacuum drain will stay there for 2 or 3 days. When the quantity of the drain is less than 25 ml, it will be removed. So it usually happens on the 2nd or 3rd day. So once the 3rd day morning, once the drain is removed and you're generally fine and you're walking around, it'll be time for discharge. Let me tell you about the complications, few complications, which I've already mentioned the complication. How do we manage it? In case of severe bleed, you need to be taken back to the operation theatre, and the bleeding has to be controlled. If there's a change of voice, we'll do a bedside flexible endoscopy and find out the cause for the bleeding, the cause for the change of voice. Is it the vocal cord, whether it's working normally or not? And according to the finding, we will manage, and we will advise you also. Breathing difficulty, it can be mild or it can be severe. If it is mild, just with oxygen and steroids, we'll take care. So when you say breathing difficulty, we'll first do a endoscopy to know what is the reason for that. So once it is done, if it is mild, steroids and observation will be more than enough. But if it is severe and the flexible endoscopy finding, we come to know the nerve has been damaged and the vocal cords are not moving properly, then we need to do a tracheostomy, which means we have to put an external opening in the lower part of the neck to communicate with the windpipe so that you breathe normally. Now, coming to hypercalcemia, I have mentioned, I'll tell you in detail because this is very important. Hypothyroidism can be taken care of by replacing L-thyroxine. Time for discharge, usually on the third day, and you'll be discharged with the following medications: antibiotics and painkillers. And you'll be advised to do the wound dressing in a local hospital nearby, or you can come back to us for wound dressing. The stitch need to be removed on the 7th day. So along with antibiotics and painkiller, they'll be starting on vitamin D and calcium too. Now, when you come back to us on the 7th day, it's time for surgery removal, and on the 7th day, the biopsy report also will be ready. And now we have a diagnosis for sure. It is follicular thyroid carcinoma. So during this 7 days waiting period, you have the take-home messages. At home, you have to do regular exercises. You have to walk around, not sit in one place and watching phone. You have to walk around and do your normal activities. And on balanced diet, drink a lot of water. And one thing is, one advice will be, do not overextend your neck. And there will be, most of the patients, they complain of throat discomfort that stays for 4 or 5 days. Even the back of the neck it will be a little painful. That also will go off within 3 or 4 days, a maximum of 1 week. Normal bathing is allowed. Take care the wound dressing does not get wet. Now, after surgery, the doctor has advised you not to take L-thyroxine. If you had been taking L-thyroxine, the thyroidome, he will tell you to stop it till further notice. So when you stop the L-thyroxine, you will have the following problems like weight gain, rounded face, swelling in the feet, cold intolerance, hair fall, muscle pain, spasm of the hands, mood change, depression attitude, and even the sleep will not be normal. So L-thyroxine need to be stopped because we have to do one more test which is usually done within 2 to 3 weeks after surgery. So we want to know whether any thyroid tissue is left behind. To diagnose that, you have to undergo iodine scintigraphy. For that, it is necessary inside your body there's no thyroid tissue, and likewise you should be iodine free also. So that's why we have stopped L-thyroxine. Likewise, you have to avoid iodine containing products also. These are the following medications which can hamper. These are steroids, nitrates, cough syrup, antihistamines and vitamins. The high iodine containing foods are seafood, dairy products, egg yolk, soya products, fortified bread and iodized salt. Don't forget the most important one. Most of us are using iodized salt at home. What you need to use till the further advice from a doctor is a common salt or rock salt. So you need to avoid all this. Now, coming specifically about hypocalcemia, post-operatively, when you are at home, if suppose you find the patient has got a mood variation and there is memory loss and irritability increases, not only that, and there is twitching around the mouth, the patient has got slight breathing difficulty, numbness in the hand, then this can be related to calcium level which is going down. The blood level of calcium is decreasing. If it is left like that, it can affect your heart also. It can beat irregularly. So it's very important to prevent this heart problem as well as the breathing difficulty. You call up your doctor and rush to the hospital at the earliest. There, he will do a simple 2 tests. One is the blood pressure will be checked, and the systolic, he will increase the cuff pressure 20 millimeters more than systolic pressure and maintain that for 3 minutes. So what will happen is, as you see in that picture, there will be a particular position of the hand. Likewise, if he taps in front of the ear, there will be twitching in the face. It means it's a simple test to confirm that your blood calcium level has come down. So you will be admitted immediately. Why? We want to avoid cardiac problems and breathing difficulty. For observation, you will be admitted immediately, and we'll draw blood to know the level of calcium in blood. We need blood to check calcium, vitamin D, PTH, and phosphorus. And ECG will be taken at the same time, or you will be connected to a monitor. So as soon as blood is taken for testing, we'll start with calcium, IV calcium, which will go on for 3 hours. Once the drip is over, we'll recheck whether calcium is normal or not. If it is normal, then the dose of calcium you have been taken will be increased and you can be discharged. So this is all about surgery, its complication and its management. Thank you so much. Now you see the next part where I'll deal with the iodine scintigraphy. If at all some thyroid tissue left behind, how to deal with that. Thank you so much.